questions tonight, you have to type them in the chat. You can, only the speakers and moderators
Oh, Alison, it's me.
speak.
So we're live now. So I'm going to start now. So good evening and welcome to yet another COVID-19 conversations. Tonight we'll be talking about a much anticipated topic that is the COVID-19 vaccine. As usual, I am your co-moderator, Dr. Maya Williams, and joining me moderating most of the event tonight will be Dr. Alison Myers. The latest COVID-19 statistics as of January 14th, 2021 in the United States, we have close to 23 million cases. Average daily cases per 100,000 in the last 7 days is 73.8, and the total number of deaths is over, or rather close to 400,000. The latest COVID-19 statistics stats, and this graph is very important because as you could see, while white non-Hispanic make up a majority of the population, Black non-Hispanic, who happen to be 13% of the population, are actually 12.3% of the total number of COVID-19 cases. The same goes for Hispanic and Latinos, who have 21.1% of the total number of COVID cases. As it relates to the COVID-19 deaths, we could see that again, while a majority of the population is white, Black and Hispanic, as well as American Indian individuals continue to be most significantly affected by COVID-19 in terms of the deaths. Today, we know that the FDA has regulatory processes in place to facilitate the development of COVID-19 vaccines that meet the FDA's rigorous scientific standards. As of today, only 2 COVID-19 vaccines are authorized for emergency use. Those are the Pfizer vaccine and the Moderna COVID-19 vaccine. For the trials of the COVID-19 vaccine, we could see that Black individuals were 9.3% of the total number of individuals in this trial, and Hispanic or Latinx individuals were 28%. From this, we see that the vaccine recipients had local reactions such as the usual pain, they had fever, and also the efficacy of the vaccine is that it showed protection for 7 days after the second dose. That is, it is 95% efficacy as observed. The limitations, and it's important to note that you have to take 2 of the COVID vaccines. So safety and efficiency beyond 2 months and in groups not included in this trial, individuals like children, pregnant women, and the immunocompromised. So a lot of people are under the impression that you could take 1 vaccine and you'll be okay, but you need to take both the vaccines. And our panelists today will explain a little bit more about that. In terms of the Moderna vaccine, we see that the Hispanic and Latino individuals made up 20% of the total number of individuals in the clinical trials, and Black or African American individuals made up 10.2%. Again, the same applies in the safety and efficacy over a longer period of time in the larger population and in pregnant women and children. So further study is actually required for that. And also further study is required to determine whether the vaccine protects against asymptomatic infection and transmission to unvaccinated persons. As we all know, or should know by now, there is a new strain of the COVID-19 vaccine. Sorry, a new strain of COVID-19, a new variant strain of COVID-19 that contains a series of mutations has been described in the United Kingdom and become highly prevalent in London and Southeast England. Based on these mutations, this variant has been predicted to be potentially more rapidly transmittable than other circulating strains of COVID-19. At this time, however, there is no evidence that this variant causes more severe illness or increased risk of death. Information regarding the virological, epidemiological, and clinical characteristics of the variant are rapidly emerging. We will talk about this today, but you also need to contact the CDC or visit the CDC website for more information. How do you get vaccinated? There are various vaccine stations around the place, and there might be limited, or you might take a very long time for you to get your appointment. So you could log on now on vaccinefinder.nyc.gov to see what areas are located in your neighborhood, in your area code, in your zip code, or in your state or constituency. Also, we would be remiss if we didn't say that Northwell Health also has vaccine stations. So you could visit www.northwell.edu coronavirus-us-covid-19/vaccine. And right now, I'd like to hand over to Andrea so that she could tell you a little bit more about our sponsors tonight.
Good evening, everyone, and thank you so much, Dr. Williams, and to our presenters for this evening. I'm extremely proud not only to be a Northwell team member, but to share that this evening's program is being co-sponsored by two very amazing organizations. First, we have Alpha Kappa Alpha Sorority Incorporated, Tau Omega chapter based in New York City, and we have Zeta Phi Beta Sorority Incorporated, Rho Omega Zeta chapter. So on behalf of our organizations, thank you all so much for participating, and we hope that you are able to gain a lot of information and insight from this evening's event. Thank you.
Thank you, Andrea. Also, we'd like to thank Dr. Naomi Maria, Ms. Stephanie Havin, the Department of Medicine at Northwell, Trial, our Day One audience members. Please remember to follow us on Twitter at Minority Health 3, on Instagram at minorityhealth.conversations. Tonight, we have our lovely panelist, Dr. Michelle Chester. She's the Director of Business Initiatives for Employee Health Services at Northwell Health, And fun fact is Dr. Chester gave the first Pfizer vaccine in the US, as well as the first Moderna vaccine in New York State. Also joining us is Dr. Alexa Gaffney. She's triple boarded in internal medicine, pediatrics, and infectious disease. She's also a breast cancer survivor and an assistant professor at SUNY Stonebrook. I'd like to hand over now to Dr. Alison Myers, who will now have the conversation with our two lovely panelists.
Good evening, everyone. And today we have a wonderful show for you. We're going to talk about the COVID-19 vaccine. And as Maya just noted, we've had a couple of studies that have come out, and the FDA has given emergency use approval to both Moderna and as well to Pfizer for the two vaccines. So we want to first introduce Dr. Michelle Chester, as she was the first person in this country to actually give a vaccine. So the nurse that you saw at Northwell who got the first vaccine in the country, well, we all know her, but most of you probably don't know Dr. Michelle Chester, who was actually the first nurse to give that vaccine and was the first nurse to give the Moderna vaccine in the state of New York. So Michelle, how does it feel to be the first to do something this epic?
At the time, I wasn't, I guess, aware of the magnitude of what I was doing. But afterwards, it was truly a proud moment. I'm so humbled by it, being an immigrant coming to this country for the education and better life. It's truly a humbling experience.
Thank you. And now I'll turn to Dr. Gaffney. Dr. Gaffney is an infectious disease specialist, so she has come in contact with COVID a lot. And like Dr. Chester, she's also received the COVID vaccine. So Dr. Alexia, can you tell us how it was between your first and your second dose? Because a lot of
Sure.
people are concerned. There have been, people making memes on the internet about growing extra arms and whatnot. So can you tell us your experience?
Sure. I still only have two, I promise. So today is my day 21. I received my second dose of the Pfizer COVID-19 vaccine today. On December 23rd, 2020, I had my initial dose of the vaccine, and the process was relatively smooth in terms of just like you would as a patient receiving the vaccine. I had to schedule an appointment at a designated location. I had to fill out a questionnaire confirming that I didn't have any signs or symptoms of an active COVID-19 infection, that I didn't have a recent serious exposure, that I wasn't recently diagnosed with a COVID-19 infection, and that I didn't have any conditions that would prevent me from getting a COVID-19 infection. I also had to acknowledge that I was not pregnant, and we'll talk about how pregnancy plays into vaccination. And then I went and got my vaccine. The vaccine is administered in what we call the deltoid muscle, so a muscle in the upper arm in the shoulder region. The shot itself was painless. If I didn't see the needle go in, I wouldn't have known that it went in. It didn't burn. There was no immediate discomfort. And I went to an observation pod where I sat socially distanced from other healthcare workers who were also vaccinated to sit through the 15-minute observation period. That observation period is just to make sure that you don't experience any immediate anaphylaxis, so those extreme severe allergic reactions that, while rare, do happen. And after that, I was off to my office and worked a regular day. Within like 4 to 6 hours of the vaccination, I began to have a little bit of discomfort in my arm. And by the end of the day, there was pain, but not severe enough for me to stop doing what I was doing. I went Christmas shopping later that day, actually, and carried really heavy shopping bags and was fine to drive the distance that I traveled, which was from Long Island into the city and back without any issues. The following day, I had a very mild headache, and if I wasn't looking for side effects of the vaccination, I probably would have overlooked it because I had things to do. I was busy. I worked a full day afterwards. I had slight neck pain on the same side that I got the shot, and my arm hurt just a little bit more. I did not experience fevers or shaking chills or anything like that, but something that was different for me is I wore my sweater in the office all day. So I would describe a mild chill. I saw 18 patients that day without any major difficulty. And what was most unusual for me is I went home, I was tired, and I took a 2.5 hour nap. That's definitely not like me. The following day, the only thing I had was mild pain in the area where the vaccine was injected. And the next day after that, I was completely asymptomatic. So for me, in terms of like decision making to get the vaccine, I really had a good idea what the side effects would look like. And I I preferred the risk of getting side effects that I knew that were predetermined versus taking a chance on getting a COVID-19 infection and not knowing where in the spectrum of disease I would fall.
Okay. Yeah, and this is pretty common. I've been hearing this from my colleagues who've already taken it, that usually the day of is not that bad, but the day after you feel can get fatigue, chills, muscle aches, and usually by day 3 or 4 you're feeling much better. I know that you took the Pfizer vaccine, and Dr. Michelle, you took the Moderna vaccine. Any difference?
Correct. There was really no difference based on what I just heard. The first day, again, took the vaccine, didn't even feel it. Couple hours later, there was some pain at the site where I got the vaccine. By the first day, the full first 24 hours, the pain in my arm did increase a little bit with the neck pain. I did, again, I guess I associated with being just tired from work. Um, but did feel a little bit fatigued, and just took a nap. Um, and I did have a low grade fever. I would say by day 2, the arm pain was a little bit worse, but again, it didn't stop me from doing my daily routine of work, continuing to travel to my pods, vaccine pods and testing pods that I have set up. And by day 3, I would say that all the symptoms were resolved by day 3, day 4 for me. It was 100% resolved. Once again, I totally concur with my colleague in the sense that I rather I know and I understand the side effects of this vaccine, and I would prefer not to have the long-term effects of COVID. So it was definitely something I do again, and I'm due for my second dose in 2 weeks.
Okay. And as a follow-up, and to go back to something that Dr. Alexia mentioned, there have been several reports of allergic reactions to some of the components that may be in either the Moderna or Pfizer. And to make not better than the other because it could happen in either one. So a lot of people who have a history of allergies have been somewhat concerned about taking the vaccine due to the fact that they're concerned that they'll have an allergic reaction. So what advice would you give to someone with allergies? And can you again explain what happens after you get the vaccine to account for the possibility of having an allergic reaction or a more severe allergic reaction, also known as anaphylaxis, where you may stop breathing, things like that?
So at all the vaccine pods that I have set up for Northwell, which is several across the region, we have, number one, we have EMTs on site. And if you have had an allergic reaction to a vaccine in the past, instead of the 15-minute observation, it's now a 30-minute observation. And if need be, we would observe you for a longer period of time. We have given out, I'm going to say a little over 20,000. I believe I'm probably, but thus far we have not seen any severe anaphylactic reactions that I am aware of. But once again, if you have had an allergic reaction to a vaccine in the past, you are observed longer. And case in point, one thing we need to keep in mind that we have taken other vaccines in the past, measles, mumps, and they also run the risk of having a reaction. So individuals have to watch themselves and monitor themselves even after they go home. So again, individuals coming in for the vaccine, you're counseled before and you're counseled afterwards to make sure that you're going into this eyes wide, know what to look for.
Thank you, Dr. Chester. We have conversations in the chat on Facebook where a lot of people are saying the same things that you guys are saying, that they did take the vaccine and they have some slight soreness. One individual in the chat asked the question, is this vaccine like the flu vaccine? Do you have to take it yearly, or how often do you have to take it after you've taken your second dose of the vaccine?
At this point, we're not aware of what the next steps would be. If it would be a yearly vaccine, that is still to be determined. Once again, this is something that we know we need 2 doses of. What the long-term, what the long-term being immunized by the vaccine means, will it wane over time? It's still out there to be seen. So we are working to ascertain if a booster will be needed yearly or it's the 2 vaccines and you're done. I'm sorry, I can't hear you, Maya.
Sorry, I'm on mute. This was bound to happen at some time. Somebody asked, can people who are on blood thinners take the vaccine, and why not?
Individuals, so that's one of the questions that we ask individuals who come in to get the vaccine. Are you on blood thinners? As far as I know, and as far as the data shows, it does not exclude them from taking the vaccine. We just caution that we will hold more pressure to the site, observe for any bleeding at the site, and for any hematomas or in this blood under the skin that may develop post-vaccination. But it does not exclude you from getting the vaccine.
Thank you. I have a question for Dr. Alexia. Both the studies done by Moderna and Pfizer have shown that they are about 95% efficacious. Can you explain what that means when we say that these vaccines are 95% efficacious or have a 95% efficacy? Because I think for a lot of people in layman's terms, that 95% seems like a large number. It sounds great, but can you explain what exactly that means?
Sure. So when we talk about the efficacy of a vaccine or any treatment, it is how often do you get the intended response. So when these vaccines were studied, when they looked at the 2 populations in the study, so there was matched arms or matched groups of participants where one group of participants got the vaccine, which was in this case the study drug, and then one group got injected with something inert, probably saline, something that gave them no immune response. And then people went out into the world and did all the things that they would normally do. And in these clinical trials, based on the number of participants in them, they have a predetermined number of positive cases or positive infections with COVID-19 that they need to evaluate and see how many of the participants got the vaccine and how many of the participants did not receive the vaccine. So when they looked at their predetermined number of cases, 94 or 95% of the individuals who ended up with a serious COVID-19 infection were in the placebo arm or the non-vaccinated group. So it shows that that the vaccine prevented infection 94 or 95% of the time. So it wasn't zero individuals who had a COVID-19 infection in terms of the group that was vaccinated with the actual vaccine, but you were much more likely to have received the placebo. And that was the way that they proved that the vaccine worked. And in clinical trials, you have to make sure that you prove that the outcomes are not related to chance. So you have to have like a certain amount of statistical significance. So it's predetermined endpoints, and you look at how many people who got infected were in the vaccine arm or the non-vaccine arm. And most of the people who had infection were in the non-vaccine arm of the trial.
And another question I have for you about the study is, most of the patients in the study were relatively healthy, and they also wore masks. So for people who have conditions like who are immunocompromised, such as having HIV/AIDS, cancer, autoimmune disease like lupus, what would you recommend for them in terms of whether they should get the vaccine or not?
So we all have to have individualized conversations with our healthcare providers, because, to say someone has HIV means different things. So my patient who has HIV is very well controlled, has a suppressed viral load and a good CD4 count. That's someone who would be a good, reasonable vaccine candidate versus someone who may be really immunosuppressed, having a really low CD4 count, or not having good viral suppression. I might want to vaccinate them when their immune system is in better condition. The same thing would be true or similar for someone with autoimmune diseases. Barring any other contraindications to receiving the vaccine, you want to look at what kind of treatment is the patient on. Is the patient on really significant immune suppressing drugs that might decrease the response to therapy? Then that might include a conversation with their rheumatologist or their autoimmune disease doctor about adjusting the immune suppressing medications in order to allow for vaccination and allow for an appropriate immune response, so that you get the most benefit that you can out of the vaccination. So these are all the kinds of things that have to be taken into consideration. And it really needs to be sort of individualized, because these are not groups that were largely represented in these clinical trials. And so we want to make sure that people get answers that make the most sense for their individual situation.
Yeah, so I think the take home point for a lot of people who are listening is you can't just rely on Dr. Chester and Dr. Gaffney to give you the answer. You really need to have a conversation with your physician, because all of us have different medical conditions. And like she was just mentioning, we all have different immune systems, and we're on different medications. So rather than just listening to the experts here, you need to have an actual conversation with your physician. In fact, I had a patient today who has a history of pretty bad asthma, and I'm his diabetes doctor, but I told him I'm more concerned about your asthma. So I want you to talk to your pulmonologist. Based on what he says, I'll support it. Because his diabetes is well controlled. So to me, it was the least of his problems. But I just really think that it's really important as a take home point, that you really need to talk to your doctor, not your cousin, not your homeboy. You need to talk to your doctor, because they're going to best know whether or not you should take it. And lastly, there's one other group that I want to mention, and that's pregnant women or women who are trying to get pregnant. I asked my OBGYN just out of curiosity, because I have a friend who's 4 months pregnant, what are her thoughts? And she said, well, because this is a new type of vaccine, I'm not sure that I would recommend that someone takes it. But I know that the American College of Obstetrics and Gynecology has said, first of all, have a conversation with your doctor, but they're not against women taking it. So can you comment on what your recommendation would be for pregnant women?
Sure. So again, it really needs to be an individualized decision, because a pregnant woman who, doesn't have to go to work every day, is, at home and in a community where the rates are maybe really low, and the other household contacts have a really low likelihood of contracting COVID-19 infection and bringing it home, is in a different position than a pregnant woman who's a doctor, a nurse, works at the pharmacy, works for the MTA, is either front line or front facing, and is exposed to COVID-19 or likely to be exposed to COVID-19. Those are the things that you have to take into consideration. And then you weigh the risk of the unknowns of the vaccine use in a pregnant woman versus what we know about the risk of COVID-19 infection in pregnant women. So pregnancy is a relatively immunocompromised state. We know from flu, right? Pregnant women are more likely to die from flu. We've seen and observed pregnant women in the COVID-19 pandemic, and we've seen deaths, we've seen premature labor, we've seen miscarriages. And so these are the complications of the infection itself. So if a woman is really likely to be exposed or become infected to COVID-19, then we would want her to seriously consider getting the vaccine. But if the risk of getting COVID-19 is really, really low, then you could consider not taking the vaccine. Unfortunately, pregnant women are not typically included in clinical trials, and it's for safety reasons, but there are databases. So whenever a pregnant woman is vaccinated, she will be entered into a database and she will be followed. Her pregnancy outcomes will be recorded. And that's how we, sort of retrospectively get the information about the safety of this vaccine in pregnant women.
Okay, thank you. So I think one of the other elephants in the room is the fact that historically, we as people of color have been experimented on. Of course, there's always the reference to Tuskegee experiment, Henrietta Lacks, and the numerous other injustices. So as women of color, how did you feel about getting the vaccine, and what would you recommend to other people? Because there's a lot of distrust. And in fact, they asked me today if I would make a vaccine video on behalf of the health system. There's been a large campaign to get people of color involved in talking about it that are in healthcare. So I'll start with you first, Dr. Michelle, and then Dr. Alexia, you.
Um, so there's definitely, when they were doing the experiments back on African Americans, we didn't have the platforms we have now to get information and to really connect with individuals. I think we have more information that's readily available to us that we can look into to gain information about the vaccine versus that what happened in the past. So definitely do your research, go into this with eyes wide open and ask questions. Do not go on hearsay or things that are posted on the web. Speak to your doctor. One of the big things, as we're all saying this evening, is every individual should have that one-to-one conversation with their physician to find out what is best for them at the time and do their research. Right now, we know what COVID can do to us on a long-term basis. The vaccine, again, science is speaking for itself with the efficacy of the vaccine and the effectiveness of the vaccine. And what I would say is the words of Martin Luther King: faith is taking the first step even when you can't see the whole staircase. And at this point, the first step is getting vaccinated. The first step is finding out all the information you can and vaccinated. So we really have to do our own research and speak to our doctors. We have to do that, taking it one step at a time.
Okay. So I think one of the major important things that needs to happen is that there just needs to be an open acknowledgement of what has happened to Black people in the past in this country and all over the world as it relates to medical research and experimentation. Um, and I don't feel like it's the responsibility of Black people to repair that. However, as a Black woman, I'm always going to be a stand for my people. I'm always going to participate in conversations like this and others to just spread information, awareness, and so that my people can make informed decisions. So when we talk about examples like the Tuskegee experiment, remember that much of the experiment was actually doing nothing, offering them no treatment and seeing how the disease progresses. And if you want to, compare COVID-19 and what the experience has been for Black and Brown people to the Tuskegee experiment, we already know from the first wave what will happen and what has happened when people were left untreated or when people did not have access to experimental therapies, when people didn't have access to care because hospitals were overcrowded, running out of medications and equipment. We died, and we died 2 times more than our white counterparts. And so when I think about the comparison to the Tuskegee experiment and thinking about what happened in the first wave of COVID-19 to Black and Brown people, I think about the aspect of no intervention and see what happens. We died, we had a lot more what we call morbidity, so a lot more chronic lung disease, a lot more chronic kidney disease. And when you top that off with people who are more likely to be overlooked, people who are more likely to experience disparate healthcare, and thinking about the fact that around the country and around the world, people are having to make decisions about rationing care. EMTs and ambulance workers get to decide who comes back to the hospital and who does not. I'm not relying on a system that has not favored my people to choose me to go to the hospital to give me the best care when I get there. And if I happen to live in a community where resources are limited, I personally don't want to chance, what my outcome would be. So when we make those kinds of historical comparisons, I think it's also important to recognize and acknowledge what we're seeing right before our eyes today, even in spite of, this is not experimentation. This is just, how this is the hand we are dealt as people of color. So when again, like I said earlier, when I know what the side effects of the vaccine are, and I know that I'm not the study population was 30 and 40,000 volunteers who signed up and agreed to take these therapies in the experimental stages so that we could learn from the data. And then I can make a good decision about why I'm choosing to get vaccinated for myself. I feel good about that. So, I'm always a stand for just giving my people knowledge, because knowledge is power.
Absolutely. And I think one of the other reasons why people are concerned is that this is a new type of virus. It's a messenger RNA virus, and most people don't even know what messenger RNA is. And this is further complicated by, and I've actually seen this on the internet too, people are saying, don't take this because the messenger RNA is going to go in and destroy your DNA. But the thing is, your DNA is already set when you're in the womb. So I'm not really sure how that would work. So if you could help by explaining what messenger RNA is, how this vaccine works, and how it will not destroy your DNA, I think that would help ease some of the discomfort that people of color are having.
Sure. So messenger RNA exists in our bodies. We have our own messenger RNA. So when you think about your genes, your genetic code, like what is your genetic programming, your genes, your DNA get transcribed, like think about like an actual, like you're typing a transcript, get transcribed into RNA, right? Or really get transcribed into proteins, excuse me. And the mRNA, the messenger RNA, is that transcript that codes for all the proteins that we express that make us who and what we are, that make up all of the individual processes and hormones and things that our bodies produce. Viruses are much simpler. So for the COVID-19 virus, what the vaccine does is it incorporates a messenger RNA, so a little transcript of just that spike protein. So the spike protein is the little literally spikes that you see all over the COVID virus particle. When you see a picture or a graphic of it, that's the spike protein. And what the spike protein does is it helps the virus enter into our cells when it's causing infection. In these messenger RNA virus vaccines, just the mRNA code or transcript for the spike protein is in a little fat molecule. That's the lipid nanoparticle, right? It's just a little droplet of fat that protects that messenger RNA so that when it's injected into our cells, the mRNA comes out into the body of our cell, not in the nucleus. The nucleus is where our DNA is, and the mRNA does not go in there. It's just hanging out in the body of the cell. And our cell's machinery, which is called ribosomes, comes and translates that mRNA, that transcript. And what it does is it tells our cells we're supposed to make spike proteins. We make spike proteins. Our immune system sees those spike proteins, recognizes them as foreign, begins to attack it, and begins to make an antibody or immune response to the spike protein. And so it primes our immune system so that when we encounter COVID-19 virus as a result of an exposure or as a result of an attempt to initiate an infection in our body is already primed to fight because it recognizes that spike protein that is all over the surface of that virus. It attacks it, and we don't get a symptomatic infection or a serious infection. I hope I answered the complete question.
I think you did. Thank you for that. There is a question though, going back on piggybacking on what you just said. What if individuals got the vaccine or the COVID-19 in about April of 2020? Would you advise them to take the vaccine now? Because maybe before we were told that the bodies could have probably developed antibodies or something along those lines. Would you advise these individuals to take the vaccine?
If they are in a risk category or in a tier where vaccine is being offered to them right now, yes, I would. At this point, we know that people can have repeat COVID-19 infections in spite of a previous infection, and it's unclear what the severity of the subsequent infection will be in a given individual. So we would advise that people go ahead and get vaccinated based on what tier they fall in terms of the availability of the vaccine at this time. Right now, we don't know how long immunity lasts for COVID-19. So there's no prerequisite, to declare that you've had an infection. There's no prerequisite to get antibody tested. If you're eligible in spite of a previous infection, you should be vaccinated. Oh, you're muted, Maya.
Sorry. Thank you very much for this. Another question, I think you mentioned that earlier, but I am not sure. Since there is no active or inactive portion of the virus in the vaccine, how does your body then recognize COVID and develop the antibodies as in other vaccine, the virus active or inactive is given?
Let's say that again, I'm sorry.
Do you want me to repeat the whole question or just the ending?
Just the whole question, please. I'm sorry. I just want to be clear.
So since there is no active or inactive portion of the virus in the vaccine, how does your body then recognize COVID and develop the antibodies as in other vaccines, the virus active or inactive is given?
Got it. Okay. So the spike protein is that the mRNA vaccines code for is all over the COVID-19 virus. It's what the virus uses to actually enter into our cells. So you can get vaccine protection against just a portion or a specific protein on any infectious agent, and that's what we're doing here. We're specifically mounting an immune response to that spike protein because it's so prevalent all over the virus. So it's just the protein we're choosing to go after. There's other types of vaccines where we vaccinate against a specific protein or antigen, we call it, when it's a foreign invader. And that is enough for the immune system to recognize the virus when it sees it. And it is enough to help the body mount an immune or antibody response, even though it's not the whole inactivated virus like we're used to with like a flu vaccine.
Okay, and speaking of immunity, this will be for you, Dr. Chester. Dr. Fauci has said that we need to try to achieve 80% of herd immunity
Mhm,
before we probably can get to the point of having our lives back. So
mhm.
can you explain what exactly does herd immunity mean? Because I think that unfortunately it's been politicized and people don't really understand what the scientific meaning of that is. And how long would it take us at the rate we're going with our
Oh,
vaccines to get there?
so loaded question. So herd immunity, right, basically occurs when enough people become immune to a disease to make it spread unlikely. So as a result, the entire community is protected, even though there may be individuals within that group who are not immune themselves. So herd immunity is usually achieved through vaccination, but it can also occur through natural infection. So for COVID-19, we need a large percentage of the population to become immune to this virus. And based on what Dr. Fauci is saying, at least 80%. And you're talking about the entire US, 80%. At the rate we're going, I mean, I'm not sure when that would happen because we need to get enough people vaccinated so that with the large population vaccinated, those individuals who are not vaccinated, it becomes the number becomes so small that the disease is not prevalent anymore. It's not spreading. Therefore, those individuals who are not vaccinated, the chances of them getting it would be so much less. So we still have a far way to go. I don't even think we've scratched the surfaces yet um, to achieve herd immunity because we really need to ramp up the vaccination in the US.
And speaking of getting our lives back, Dr. Gaffney, I have a question for you. What are your recommendations in terms of travel? A lot of countries are recommending that if you come, you need to have a vaccine or you need to at least have a COVID test. Whereas domestically, we really don't have any regulations in place. I know one of my friends, she's a flight attendant, and she talks about it's like a daily battle of telling people to pull up their mask. You don't know what you're being exposed to. So can you comment for our listeners on the safety of traveling during this time, whether it be domestic or international?
Sure. I think one thing that I'm always reminding people of, because people are confused, they don't know what they should or should not do. And the reason for that is that some of the decisions being made are public health decisions, like wearing a mask, staying home, having people work from home, asking people to limit their time in indoor places outside of the home, etc. Those are public health decisions. The fact that malls and gyms and airlines are open are economic decisions. And so we have to be careful not to confuse the two. Even though you are free to move about the country, the recommendation is that people avoid non-essential travel. So if your travel is not for work, employment, if you're not, a doctor or nurse or other healthcare professional flying to some other part of the country or the world to aid in COVID relief, then your travel is non-essential, and the recommendation is that you not do it. In America, we are all screaming about our freedoms, and I'm certainly not one who is trying to take anybody's rights away. You have the right to travel, but it's not the best idea right now. So if you are going to travel in an effort to decrease the spread of the virus across the country or to other countries, it is recommended that you have a COVID test, usually within 24 to 72 hours of travel. The rules are variable from place to place. There are places that you can travel to that want you to isolate and quarantine. Sometimes it's a full 14 days quarantine. So does your travel plan even allow time enough for you to quarantine when you get where you're going? So you really have to know the rules where you're traveling. Like, what does it take to get to that place? What does it take to get back home? What does it take to return to work or school? You know, you have to consider all of those rules. You have to have all of the testing available to you. It has to be timed appropriately. Some places are even requiring specific testing. Some places don't want rapids, they want a lab PCR. And so you really, really, really need to fully investigate if you are planning to travel. But again, the recommendation is to avoid non-essential travel. That being said, on an airplane, I would recommend wearing a mask, you know, wearing a face shield, taking disinfectant wipes to wipe down the seatbelt buckle, the armrest, the tray table in front of you. If you have the window seat, the wall of the window, in case you fall asleep and you find yourself leaning up against it. I would close the vents because you don't want that air blowing in your face. And I would utilize, you know, a disinfectant wipe to do that, or disinfect my hands afterwards. I wouldn't touch a snack. I wouldn't do anything. I wouldn't take a sip of water, me personally. If I had to get on a plane, there wouldn't be anything important enough that they're going to serve me that would make me take my mask down for any reason at all. So again, you're free to move about the country if you want to. It is your right, but the recommendation is that non-essential travel be avoided.
Thank you. I'm so happy that you said that, because I have heard this comment in the past that, I mean, from March, I haven't left my house, no problem there. But I have heard people say that I choose to stay in the house because the rest of the world is open. So they're living life, you know, as much as they can while, and I agree that this is an economic decision to have, you know, airplanes running and the world running as if there's no COVID-19. And it's definitely creating, like, you know, double messages for individuals.
Yeah.
I do have a question to sort of move away, because we spoke about Pfizer and we spoke about Moderna, but an individual asked a question where it was around the Johnson vaccine.
Mm-hmm.
And so the Johnson vaccine, I believe, is only, you need only one shot. So what's going on with this? Would you recommend this to individuals? And what about individuals who are afraid of needles? Would that be a better vaccine to take as opposed to one where you require 2 doses?
So it's hard to make a recommendation when we don't have, you know, FDA approval or emergency use authorization, you know, at this time. So when we, just to speak generally, when we have clinical trials, when a particular regimen is designated, it is based on the clinical trial and the clinical trial outcomes. So the COVID-19 dosing for the Pfizer and the Moderna vaccines is because it was a 2-dose regimen. That's the way it was studied. And they showed that you got superior efficacy with 1 dose versus 2. There are cases or instances where vaccines can give you a higher efficacy with a single dose. And so, you know, that has to be that's the way their trial is laid out and planned. And if there is significant enough efficacy and there's enough of a safety profile, then we anticipate that vaccine and other vaccines will eventually get either approval or emergency use authorization. And then other things besides, I don't like getting poked in with needles, come into play. So some of the things that we want to consider with these vaccines is like, are people of a certain age group more likely to get benefit than, are younger people going to benefit more from this particular vaccine, or are elderly people going to benefit more from this particular vaccine? Those are the kinds of things that need to be considered. Did this particular vaccine's clinical trial look at people that have my same health conditions, health concerns? Those are the kinds of things we want to look at and see, is this the right vaccine choice for me? Not a matter of, do I have to get poked once or twice with a needle? You're looking for safety, you're looking for effectiveness, and you're looking for, does the clinical trial participants, does that sample of individuals reflect who I am and what my outcomes are most likely to be?
Okay, thank you. So I want to finish up with, I think, probably one of the most important questions for both of you is, how do people get vaccinated? So here in New York State, as of Monday, they started doing phase 1B. So we started with phase 1, so it's people like us, healthcare workers, first responders, and then they were moving into phase 2, people like police officers, fire department, teachers, and people over the age of 75. So for people who fall into either 1A or 1B who have not gotten the vaccine, would you be able to share with the audience how they can go about getting it?
So in New York, they did decrease the age to 65 now. Now they're looking at individuals who are smokers and who have a lot of predisposing conditions. So I would definitely look at the state website, because there are a lot of large vaccine pods that are opening, and set your appointment early. Start booking it now, because what I'm understanding is that you may book it today, but you may not get it for several weeks out. So the sooner you can schedule your appointment, the sooner you will be able to, your turn will come to get the vaccine. Fortunate to work for Northwell, where, the goal is to vaccinate the entire workforce. And one of the charges that I have is setting up the regional vaccine pods for the team members. And we're vaccinating, whether it's in, we set up geographically, Staten Island, New York City, Long Riverhead, everywhere, to make sure that our workforce is completely covered. But for the general public, please refer to the state website for those locations and appointments.
And Dr. Gaffney, so you're out in a private practice. How about people who are seeing PCPs? Do you have any idea
Yeah, so
of getting them out?
yeah, so right now we don't have vaccines in. It's the Department of Health and the large medical centers that have the vaccine available. I know my practice pre-ordered, as did some of the other large private practices and multi-specialty groups, and everyone is just patiently awaiting their shipments. Hopefully, when there is broader access to the vaccines, it will relieve the sort of bottlenecking that is happening with only, certain designated points for vaccination. It's a lot easier to go to your primary care provider and get a dose of the vaccine versus having to compete with everybody in your county, city, town, etc., for a dose at a given access point. So I think down the line, when the vaccine is more readily available at multiple sites, it'll be a little easier to get it. But I agree, right now, just schedule an appointment just in case, those doses that we anticipate getting in the private sector don't come down the pipeline.
And just to add, a lot of the bottlenecks are coming, for example, the Pfizer vaccine has to go in a sub-zero fridge.
Yeah.
Not every private, imagine a private practice that has to purchase a sub-zero fridge.
Right.
That handling is very difficult. So that is one of the biggest obstacles with the Pfizer. With the Moderna, it goes into a regular fridge. So it's more easily manageable. So I think that's one of the big bottlenecks right now to getting it into the private practice sector. So again, we just have to be a little bit patient until, hopefully the Moderna would pick up and it's easier to get it into the private practice sector.
Yeah.
Well, that was a wealth of information. I can't believe how much time can just fly by so quickly. I would just like to thank both of you, Drs. Chester and Gaffney, for giving so many jewels today for this talk on vaccines. And I think we could have had another hour if need be. And I just wanted to say thank you to my downstate alumna. It's a wonderful place to go. And it's just great to see
Yes.
the products of SUNY Downstate doing wonderful things. So thank you again. And I also want to thank our co-sponsors, Zeta Phi Beta Sorority Incorporated, Rho Omega Zeta chapter, where Gretchen Cotton Rodney is the bacillus, as well as Alpha Kappa Alpha Sorority Incorporated, the Tau Omega chapter, where Michelle Hardy is the bacillus. Back to you, Maya.
Hi, so we had a little mishap a while ago where I did not share my screen. So I'll go back and share my screen to go over the PowerPoint because we have some very important information in there and we want to just reiterate that information. Can everybody see my screen now? Thank you.
Yes. Yes.
Yes, we can.
Okay. Okay, so I started with good evening and welcome to yet another COVID-19 conversations. We were discussing COVID-19 vaccine. I am your co-moderator and so is Dr. Alison Myers, who gave a wonderful presentation today. So the latest stats on COVID-19 is that we have now in the United States over 23 million cases, and that's as of January 14th, 2021. The average daily cases per 100K in the last 7 days is 73.8, and we have total deaths of close to 400,000. So the latest COVID stats, that is by the number of cases. As we could see, white non-Hispanic make up a majority of the population. However, Black non-Hispanic individuals make up 13% of the population. However, they are 12.3% of the total number of COVID-19 cases. The same goes for Hispanic and Latino individuals who make up 21.1% of the total number of COVID cases. In terms of the total number of deaths, again, while we see that white non-Hispanic make up a large percentage of the population, the total number of Black deaths due to COVID-19 is 16.1%. And remember, the total number of Black individuals in the population is 13%. The total number for Hispanic/Latino deaths is 13.3%, and the total number of American Indian deaths is 1%. The COVID-19 vaccines, the FDA has regulatory processes in place to facilitate the development of COVID-19 vaccines that meet the FDA's rigorous scientific standards. As of now, there are 2 COVID-19 vaccines who are authorized for emergency use. That is the Pfizer vaccine and the Moderna COVID-19 vaccine. In terms of the Pfizer vaccine, as per the clinical trials, Black or African Americans made up 9.3% of the total number of individuals in these clinical trials, and Hispanic or Latinx made up 28%. And so we could see that the vaccine, for the Pfizer vaccine, the vaccine showed a protection of 7 days after the second dose, and that is 95% efficacy as observed. Further study is required to understand the following. 1, the safety and efficacy beyond 2 months and in groups not included in these trials. The groups who were not included included children, pregnant women, and the immunocompromised. Whether the vaccine protects against asymptomatic infection and transmission to unvaccinated persons. And we also have to understand how to deal with those who miss the second vaccine dose. Again, to reiterate, before we were saying that you need 2 doses of the COVID-19 vaccine. A lot of individuals believe that you could take the first dose and go about your merry business, living your best life and traveling the world. That's not the case. You need to take 2 doses of the Pfizer vaccine. Next, we have the Moderna vaccine. Again, we could see that Black or African Americans made up 10.2% of the Moderna vaccine clinical trial, whereas Hispanic or Latino individuals made up 20.5%. You have to take this vaccine, I believe, 28 days apart, or your second dose. For further study is required to understand the following: safety and efficacy over a longer period of time in a larger population, and in pregnant women and children. whether the vaccine protects against asymptomatic infection and transmission to unvaccinated persons, and last, again, how can we care for those who miss the second vaccine dose? Again, if you're taking the Moderna or the Pfizer vaccine, you cannot take the first dose and go and live your best life. You need to take both vaccines. There is also a new strain of the COVID-19 vaccine. A new variant strain of COVID-19 that contains a series of mutations have been described in the United Kingdom and become highly prevalent in London and Southeast England. Based on these mutations, this variant strain has been predicted to potentially be more rapidly transmissible than other circulating strains of COVID-19. At this time, there is no evidence that the variant causes more severe illnesses or increased risk of death. In order for you to get more information, visit the CDC website to get more information about this new strain of COVID-19. How to get vaccinated? You could go to vaccinefinder.nyc.gov/locations and look for any vaccine finder in your zip code, in your county, in your state. Also, we would be remiss if we didn't shout out Northwell Health. You could visit www.northwellhealth.edu/coronavirus US-COVID-19 vaccine. Thank you so much for joining us for yet another epic COVID-19 conversations. A few takeaways is that we as Black people, we cannot depend on a system who has over and over failed us. We need to get the information from ourselves. We need to visit the COVID-19, we need to visit the CDC. We need to also look out and support COVID-19 conversations like this, where we have people who look and sound like us who could bring us this information. We also need to have this conversation with our provider as to what to do in terms of the COVID-19 vaccine. We could see that we are not always in clinical trials because we have a mistrust of the health systems across the United States. And because of that, we have to take a more proactive approach. Just because the world is open doesn't mean we have to live our best life. Like I said, again, you have to stay home, you have to protect your family, you have to protect yourself. If you decide to take the vaccine, you know that you need to take both of the vaccines. You cannot take one and then figure you do not have to take the other one. You have to take both of the vaccines. Feel free at any time to reach out to myself or Dr. Myers for any more information that you need, and we could direct you to the right people. Again, please be sure to visit northwellhealth.com or .edu because we have a plethora of information on where vaccines are available and what you should do for you to get the COVID-19 vaccine. Thank you so much for joining us this evening.
Come back February 4th.
Yes.
I just wanted to
come back
Maya,
February 4th. Please, we have our next show, a Black History Month, a special show about Black history and medicine. So please join us February 4th at 8 p.m. And also happy Founders Days to the wonderful women of Alpha Kappa Alpha Sorority Incorporated.
Yes.
So I just wanted to add one thing, Maya. Can you hear me?
Yes.
Just to note with the vaccine, if you start with Pfizer, you have to end with Pfizer. If you start with Moderna, you have to end with Moderna. You cannot take Pfizer and then Moderna. Please remember that when you're going.
Thank you. So if you start with Pfizer, you have to end with Pfizer. If you start with Moderna, you have to end with Moderna.
Correct.
Hi, Maya. Maya, this is Tiffany. Just real quick, I did ask a question when I got my my shot, and they gave me a date to come back. Come to find out that was the final date that I can get my shot. So when you get your shot, whether it's Pfizer or Moderna, be sure to ask them, what is your window to get your shot? I was told that I can have, I got mine on January 4th. I go back on February 1st. However, that is the last day that I can get my shot. I can go get it within 4 days of that time, of that date, but that is my last day. So 4 days prior to February 1st. Be very clear about the dates that they give you, because a lot of times people may not realize you don't want to go past that date. So because I work in research, I knew to ask this question. So just be very clear to ask, what is your window? Just in case it lands on a Saturday or something, you want to be able to get your shot within your proper window.
Thank you very much, Tiffany. And that is, do not wait the last minute to get your second dose. Try to get it within the window of opportunity opportunity so that you could get the best results from getting the COVID-19 vaccine. Remember, do not, and nobody could force you to take the COVID-19 vaccine. The decision is yours. You get the information, you check your PCP, and you make the best decision for you and your family and whatever you feel comfortable with doing. If you do not take the COVID-19 vaccine, continue to social distance, continue to wear your mask, continue to wash your hands, continue to stay in your house. You will not die. If we stayed in our house from since March, this would be over. Just continue to follow protocol and we'll be fine. And by December, we could start traveling again. Thank you, everyone. And I will see you on February 4th.
Thank you so much, everybody. Thank
Bye.
you. This was very, very informative. Thank you so much. I enjoyed every bit of it.
Thank
Bye.
you.
Thank you.
Bye.
Thank you. Good evening.
Good night.
Bye. Good night.
All right.
Bye.